A standoff over the firing of CDC Director Susan Monarez is having ripple effects within the agency. According to her lawyers, Monarez has neither resigned nor received official notification from the White House. But the White House says President Trump did fire her. In the wake of all of this, several other top CDC officials have resigned, citing what they call political interference in their work. CBS News medical contributor Dr. Céline Gounder joins us now. She's also editor-at-large for public health at KFF News. Dr. Gounder, thanks for being here. Talk to me a little bit about how will these departures affect the way the agency is run?
So heading into this week, we'd already had tremendous cuts sustained by the CDC. So as you remember, April 1st, there was a 25% cut to their budget, to their staffing. That included many of the directors of the centers. So the Centers for Disease Control and Prevention, there are multiple centers within that. Many of these already were functioning without leadership. And then on top of that, you had a senior leader in charge of data who resigned earlier this week, and then 3 more leaders who resigned after Dr. Monarez was informed that she was being fired. 3 more resigned after that. And so you're really dealing with an agency that's just sustained its own shooting, that has not had much in the way of outreach from the folks in D.C. in response to that, and then now really rudderless without leadership to guide them.
And there's apparently going to be a walkout today.
Yes, they're calling it a clap out around 3 p.m. today to show solidarity and support for the 3 leaders, as well as Dr. Monarez, who are no longer at the CDC.
All right, we'll keep following that. In the meantime, the FDA just approved this fall's updated COVID vaccine. There are some restrictions. Who can actually get it?
So the people who can get it, according to the FDA approvals, include people who are over 65, and then anybody between the ages of 6 months and 65 who has at least 1 risk factor for severe COVID. Now, pregnancy, to be clear, is a risk factor for severe COVID, so that does include pregnant women. And then for people who are healthy between the ages of 6 months and 65, that's in consultation with your doctor. So if you and your doctor decide, you know what, this is something you want for the fall, winter season, you can still have access that way.
All right, great advice, Dr. Gounder. Thanks for being here. Appreciate it.